You may have been researching brain fog, anxiety, mood, ability to focus. These types of things are hot topics that have become ever more prevalent. And what you might be finding in your research is a treatment called TMS, Transcranial Magnetic Stimulation. And we're going to get into some of the nitty-gritty of some of the cool research and application of this cool tech. So transcranial magnetic stimulation, there's lots of devices out there. This is Exomind, which is the newest evolution. It's more efficient, more accessible, and it is something that is available more readily to more patients today. How cool is that? What it comes down to is whether you're a man or a woman, young or old, we have more stress, whether it's social media stress, work stress, health stress, things related to long COVID. All these different things may be affecting you. And guess what? The common thread with all of these stressors that lead to brain fog is, why is there brain fog? Because there's decreased blood flow as a protective mechanism in the brain to the left dorsolateral prefrontal cortex. I know that's a mouthful, but that area of the brain, the body protects itself under chronic stress. In that area, we get foggy thoughts, loss of balance of focus. That is what we're going to continue addressing today. One is we need to have proper assessment and evaluation from a professional. We don't want to be relying on Dr. Google to address these things. But the common thread, again, with all of these concerns is what happens is under these stressful scenarios, we end up getting a compromise to the left dorsolateral prefrontal cortex. So this is a common thread. A great example is if someone has low hormones, their hormones aren't balanced, they lack focus, motivation, and drive. These are the same things that area of the brain is responsible for. So we want to get proper assessment, but we have a treatment option that actually can address all of those concerns under one umbrella. How cool is that? The answer is absolutely yes. We were not meant to have this digital overload, this sensory overload, where it's an on all the time. There's no disconnection, there's no downtime. And what happens is all of this stimuli, whether it's good or bad stimuli, overloads our control center. And the area of integration in the brain that helps decision making is the left dorsolateral prefrontal cortex. So what's happened is we are actually overloading the area that is the area that makes decisions. And what happens is our body has to protect itself and says, whoa, we need to slow down. So it actually protects itself by decreasing blood flow, decreasing stimulation to that very crucial area of integration. So absolutely, we have seen a change. So TMS, Transcranial Magnetic Stimulation, is delivering magnetic pulses primarily to the left dorsolateral prefrontal cortex. So what we are doing is we're really doing gentle brain stimulation. We are waking up and supporting the area of the brain that tends to get shut down through chronic stress, stressful events. And it's something that traditionally has been used for major depressive disorder and more serious diagnoses related to psychiatric disease. Exomind is absolutely different from traditional TMS, which has a 40-year history of use, but it's older technology. Exomind is much more comfortable. Traditional TMS is more painful and loud and claustrophobic. And for a patient, I don't want you to experience pain, especially when I'm delivering energy to actually relax your brain. So for you, I don't want you to be claustrophobic. So to feel more relaxed, most of my patients are able to actually sleep during treatment. They're so relaxed. Traditional TMS, you have to do multiple treatments, 20 to 30 treatments on a daily basis. With Exomind, we're able to do treatments once a week or twice a week for a total of 6 treatments and get the same therapeutic outcome. So for my patients and you, with comfort and ease, and it's in a relaxing environment. That's very cool. Many patients will be a good candidate for Exomind. Not everyone with brain fog is going to respond to TMS because we want to make sure that you're well evaluated and other things are ruled out because there could be nutritional concerns, there could be hormonal concerns. And I also want to preface that patients may need support of someone that they can talk to, whether it's a counselor or a therapist, because sometimes as we're doing treatment we can have breakthrough, which means that some things come to the surface that we need to talk about. So we want to have proper support. What I would say, 20% of potential patients may have some sort of diagnosis relating to their mood. The other 80% of patients, which is the majority, are patients that have no diagnoses related to any kind of psychiatric concern, but they might have brain fog, difficulty focusing, difficulty sleeping. All of those things are things that can also be improved with TMS. And I'd say from my experience, most of my patients very quickly notice improvement in both their sleep, mood, and brain fog very early into treatment. The easy answer is sometimes. So what can happen is if a patient is on medication, your medication can work better when you initiate TMS. Other times, you may be able to go off of a medication. Other times, you may use it as an alternative to a medication. What I will say is there's a growing trend where patients are wanting a drug-free option. This is absolutely the most evidence-based drug-free option we have for addressing things related to mood, focus, motivation, sleep, and brain fog. So if any of those things are a concern to you, this is an absolute adjunct that works well with medication or without. What I would advise though is the standard of care with TMS therapy is we don't change any medication or supplements because people are doing a lot of different supplements for all of these same concerns, and we keep things consistent through the TMS therapy because guess what? The real improvements with TMS take place over time. So after completing treatment, that's when modifications can be made as someone's not just feeling their best, but they're also noticing an improvement in all of those different concerns. We have over 20,000 studies over the last 40 years related to TMS. What's so exciting is to have this kind of technology being more readily available for the general population, because generally it tended to be reserved for people that were very ill or had already failed multiple therapies. What I can tell you from an evidence-based standpoint, we know that TMS therapy using magnetic stimulation of the brain increases neuroplasticity. This can be measured. So what we know is that over time, we get more neuroplasticity that can be measured. And what that is more interconnectedness in the brain. The way you can think about it, it's like you've got more enhanced circuitry. So we have more connectedness that allows us to balance logic and emotion and enhance our ability to make decisions. And when we do that, it improves our ability to focus, be motivated, and be successful in our day-to-day activities. How cool is that? As a participant in the whole process, I've had the good fortune to be able to actually conduct some of the research that has been published relating to TMS. And that's not going anywhere because there's an exponential increase in this kind of interest. So as far as science is concerned, this is the most grounded in science technology that I've seen related to brain health, cognition, and at the end of the day, you could wrap that all up and say as a non-drug way to address brain fog. How cool is that? You may be asking, can TMS help people that are not depressed? And it's absolutely clear that it can. I actually conducted the first study looking at generally well people. And what was interesting is when you recruit patients for a study of generally well people, you find very quickly that 20% of patients have major depressive disorder. But what you find is about 80% of the general population is generally well. And what we found is that even if someone has a good mood, doing Exomind improved their mood a little bit more. They just felt generally happier. We also found that it improved sleep, a reduction in anxious symptoms, and improved focus and motivation, and even helped with weight loss. Meaning, we didn't even talk to patients about losing weight or nutrition, but those patients over time made better choices, and ended up losing weight. Very interesting. So what I would say is the most interesting application of TMS, more from a cognitive enhancer, cognitive prevention, is absolutely looking at transcranial magnetic stimulation as the new frontier. Because guess what? It just wasn't available before because the technology wasn't ready. With Exomind, we're ready to go now, which is really exciting. My goal with this was to be able to share some of the history, the science, and some of the go-to questions that will help you when you're exploring something as broad as transcranial magnetic stimulation. I appreciate that you spent the time watching this video, and at the same time, if there's other questions, other things related to science, future research, treatment application, or any concerns, feel free to reach out, and I'd be happy to try and support that. And I look forward to seeing you in future videos. Cheers.